For a nation sprawled across more than 7,000 islands, this might come as a bit of a shock. The Philippines actually holds the 6th highest number of human rabies cases worldwide.
Wow. 6th highest, despite being islands.
Exactly. It's surprising and, frankly, deeply concerning, and that's really the starting point for our deep dive today.
Right. We're diving into the heart of the rabies epidemic in the Philippines, and it's not just, a few sad stories. It's a major public health crisis.
Absolutely. And just for clarity, rabies, it's a viral disease attacking the central nervous system, right? The body's command center.
That's it. And once symptoms show up, it's almost always fatal. We're talking near 100%.
It progresses from like a fever and pain near the bite.
Yeah, that initial stage.
To this severe fatal brain inflammation. Encephalitis is the term.
Encephalitis, correct. Think of it like the whole system just gets overloaded, completely malfunctions.
And recovery is incredibly rare, isn't it? Even if someone does survive, they can have serious, lasting neurological problems.
Very serious, yeah. So our mission today really is to understand what's driving this, the causes, the impact, and crucially, what solutions might be out there.
And we're basing this on the reports, the case studies, and the overviews you've gathered for us.
Exactly. Let's start with the numbers because they really paint a picture.
Okay.
In 2023, the Philippines recorded 55 deaths from rabies. That's actually up from 51 the year before.
An increase. Not good.
Not good at all. And then, tragically, the start of 2024, just January, saw another 7 deaths.
So it's an ongoing, immediate problem. And who's most affected? Is there a pattern?
There is. It's primarily hitting adults aged 20 to 59. And there's a notable gender split. Men accounted for, get this, 72% of cases in 2023.
72%? Wow. Any idea why that might be? Exposure through work, maybe?
That's a possibility, linked perhaps to outdoor activities or occupations, but the data doesn't specify the exact reason for that disparity. It's striking, though.
It really is. And as you said, once symptoms appear,
it's a rapid downhill spiral. That initial fever, the pain, it escalates quickly into that devastating neurological attack.
Okay, let's talk transmission. How is it spreading? The animals involved.
Right. The primary vectors, the carriers, are animals. In 2023, dogs were the main source responsible for 71% of cases.
The vast majority.
The vast majority. Cats made up the other 29%.
So mostly dogs. And is it mostly stray dogs?
That's a huge factor, yes. The sheer number of stray dogs is a major issue. They roam freely, often unvaccinated.
But it's not just strays, is it? I read that owned dogs are also part of the picture.
That's a really important nuance. Yeah, many owned dogs are allowed to roam, kind of blurring the lines with strays.
So they can pick it up or spread it just as easily if they're not vaccinated and supervised.
Exactly. And this links directly to the incredibly high rate of dog bites. It's over 800 bites per 100,000 people annually.
800 per 100,000. That's a lot of bites.
It's a substantial risk level, absolutely.
And that must explain the surge in people needing treatment after a bite, the PP.
Precisely. Post-exposure prophylaxis, or PP. It's that course of vaccines, sometimes antibodies too, given after exposure.
And the numbers there are climbing.
Dramatically. We're now seeing over 1.2 million PPP treatments giving out each year. That's double the figure from 2013.
Double in a decade. Wow. Okay, so on one hand, maybe that means more awareness, people seeking help.
That's the positive spin, yes. Increased awareness is good.
But it also just shows the sheer scale of the exposure risk people are facing daily.
It absolutely does. It highlights how pervasive this problem is.
And the impact goes beyond individual health crises, right? It affects whole communities.
Oh, definitely. It creates this underlying fear. It disrupts everyday life, and the strain on the healthcare system is immense.
You mentioned San Lazaro Hospital in Manila as an example.
Yeah, a really stark one. In 2024, their daily consultations for animal bites just exploded, went from around 800 a day.
Which is already a lot.
Already huge, yes, to over 3,000 a day.
3,000. How does a hospital even cope with that surge?
It's incredibly difficult. Resources get stretched thin, staff are overwhelmed. It's a massive strain.
And I imagine it's even tougher in rural areas.
Much tougher. Access to PP can be really limited distance, lack of facilities, and then there's the cost.
Ah, the cost. How much are we talking?
On average, about $108 per patient for the full course.
Okay, $108. That might not sound astronomical to some, but
compare that to daily earnings in many rural areas, which can be as low as $1 or $2 a day.
So potentially months of income for a life-saving treatment. That's That's just an impossible choice for many.
It's a devastating economic barrier on top of the health risk.
And are there cultural factors involved too? I read something about eating dog meat.
Yes, the practice of consuming raw dog meat, known as killuin, if the animal is infected, handling the raw meat, especially with any cuts or breaks in the skin, could potentially transmit the virus. It's another risk factor.
Goodness, this really brings home the human cost. You mentioned some specific cases.
Yes, the sources included some really affecting stories. Tragic examples.
Like the young girl, Jamaica.
Yeah, Jamaica, 13 years old, in Manila, this was in 2024, bitten by a stray dog.
Okay.
But she hid the bite from her parents. She was scared, apparently.
Oh, no?
And by the time symptoms appeared, about 2 months later, it was too late. She passed away.
How heartbreaking, just because she was afraid to tell someone.
Exactly. The reaction online, the grief, it really spotlighted the need for awareness, especially making sure kids understand the danger and feel safe reporting bites.
That's crucial. But there are stories with better outcomes too, right? Like Sarah.
Yes, Sarah's story from 2019 offers some hope. A young girl in a rural area bitten quite severely on the face by a stray.
On the face, that's high risk.
Very high risk. But her mother, Susan, acted immediately. Washed the wound thoroughly, which is critical.
Right, the first step.
And then rushed her to the hospital in Naga City for PP.
And it worked?
It did. That quick action almost certainly saved her life.
That's incredible. A testament to her mother's awareness.
It really is. And importantly, 2 other people bitten by the same dog also got treatment. The dog tested positive for rabies and was euthanized.
So it prevented further tragedy. But it also kind of highlights the challenge you mentioned earlier.
Exactly. Rapid access to care saved Sarah, but that access isn't guaranteed for everyone, especially rurally.
And there were cases where PPEP didn't work, back in 2003.
Yes, those Manila cases are a stark reminder. 2 children died even though they received some PP.
Why? What went wrong?
In one case, a 4-year-old girl had deep wounds, and they were stitched up. That's actually against protocol for bite wounds, as it can trap the virus. In the other, an 8-year-old boy only got 1 dose of the vaccine, not the full course.
So incomplete treatment.
Incomplete or incorrect procedure. A study looked at 151 confirmed exposures around that time. 149 survived because they got proper complete PP. Those 2 didn't.
It really drives home the point. You need the full course administered correctly. And education for healthcare providers is key too.
Absolutely vital. Both aspects.
Okay, let's dig a bit deeper into the root causes. We keep circling back to the dog.
The stray population, yeah, it's a massive driver. Estimates are around 7 million dogs total.
7 million. And vaccine availability.
That's the crunch. Only about 42,000 doses available annually through government programs.
42,000 doses for potentially millions of dogs needing vaccination. That's nowhere near enough.
Nowhere near. You need about 70% coverage for herd immunity to really break the cycle. We're falling dramatically short.
Is there legislation, laws about this?
There is. The Anti-Rabies Act of 2007. It mandates dog vaccination and registration.
So the law exists.
So the law exists, but like we touch on, enforcement is the challenge. It's inconsistent, especially in rural areas where free-roaming dogs, sometimes guard dogs, are common.
And external factors can make things worse, like the pandemic.
Yeah, COVID-19 had an impact. About 12% of rabies program funds got diverted to the pandemic response.
Resources shifted.
Exactly. And vaccination campaigns were disrupted. We even saw a slight uptick in reported dog bites during that time, 2019 to 2020.
It shows how fragile these programs can be. What about public understanding? Are there common myths?
Big ones, unfortunately. A major misconception is that only strays carry rabies.
But the data shows otherwise.
Clearly, in 2023, 57%, over half of the animals confirmed rabid, were actually unvaccinated pets. Owned animals.
57%. So people think their own dog is safe, but if it's not vaccinated and it encounters a rabid animal.
It's a huge risk. It highlights the need for responsible pet ownership and universal vaccination, not just targeting strays.
Are there other misconceptions hindering things?
Yes, sometimes people still rely on traditional healers, these can docs, instead of seeking immediate medical care. That delay can be fatal.
Delaying PP is incredibly dangerous.
Absolutely. And then there's the vulnerability of children. They account for about 40% of victims.
40%. And as we saw with Jamaica, they might hide bites.
Right. Fear, lack of understanding. It prevents them from getting that crucial immediate help.
And even if people do seek help, getting PEP isn't always straightforward.
No. While having over 500 animal bite treatment centers, ABTCs, is good progress.
Well, that sounds like a decent number.
It is, but supply shortages of the vaccine still happen. And again, the cost remains a huge barrier, especially outside major cities.
And you mentioned the way the vaccine is given, intradermal versus intramuscular.
Yes. The WHO recommends intradermal or ID administration. It uses much less vaccine per dose, making it more cost-effective.
So it could stretch supplies further.
Exactly. But many clinics still use the older intramuscular IM method, which needs about 5 times more vaccine per patient. So switching fully to ID could make a big difference in accessibility.
Okay, so we've got stray populations, enforcement gaps, funding issues, misconceptions, access barriers. It's a complex web.
It really is. Multifaceted.
But you said there are solutions being implemented, signs of progress.
Definitely. It's not an insurmountable problem. There's a concerted effort aligned with that WHO 0 by 30 goal.
Zero dog-mediated rabies by 2030. Ambitious.
Ambitious, but the framework is there. A key part is mass dog vaccination.
Right, getting that 70% coverage.
That's the target. The government runs free campaigns, especially during Rabies Awareness Month in March. And we have success stories.
Like Bohol.
Bohol province, yeah. They started a program back in 2007, set up 6 ABTCs, trained staff, and crucially maintained sustained dog vaccination.
It work.
It led to a significant, lasting reduction in human cases. It shows sustained effort pays off.
That's encouraging. Any other recent examples?
More recently, GRRC, the Global Alliance for Rabies Control, was active in 2024, vaccinating dogs, but also educating school children, over 1,600 kids. And they certified local rabies educators, too, building capacity within the community.
That community engagement feels vital, and public awareness campaigns alongside the vaccinations.
Essential. School programs, teaching bite prevention, responsible pet ownership, getting the message out clearly.
Does that make a difference?
Evidence suggests yes. That 2018 Stand Z project in Baikal, it led to more people reporting suspect dogs and, importantly, more people washing wounds correctly after a bite.
Small changes, big impact potential.
Exactly. And even social media, sadly spurred by cases like Jamaica's, has raised awareness and driven more people to ABTCs.
What about controlling the animal population itself, spaying and neutering?
A critical long-term strategy, reducing the number of strays overall. We've seen it work elsewhere, like Goa in India, where vaccination plus sterilization was key to eliminating human rabies.
Does the Philippines do this?
There are ordinances against free-roaming dogs, and the Anti-Rabies Act supports impounding strays. Spay-neuter programs exist, but perhaps aren't as widespread or systematic as needed. And again, enforcement and those cultural factors around roaming dogs play a role.
Okay. And on the medical side, better vaccines, better PP administration.
Yes. Using WHO pre-qualified vaccines like Rabies, Verirab is standard, and the shift towards that cost-saving intradermal ID method for PPP is happening, though maybe not universally yet.
Is there anything before exposure, like preventative vaccines for people?
Yes, pre-exposure prophylaxis. It's recommended for high-risk groups like vets or animal handlers. A 2019 Philippine study suggested it could be cost-effective in high-bite areas.
So another tool in the toolbox.
Definitely. Research into newer vaccines is ongoing too, but ensuring stable supplies of current, effective vaccines is the immediate challenge.
It all seems to point towards needing a very integrated approach. You mentioned One Health.
Exactly. One Health recognizes that human health, animal health, and environmental health are all interconnected. You can't effectively tackle a disease like rabies, which jumps from animals to humans, without addressing all sides.
So different government departments working together.
Precisely. The Philippines' national program is WAH endorsed. That's the World Organization for Animal Health. It involved the Department of Health, the Department of Agriculture, local governments all coordinating.
And has this One Health approach shown results?
Yes. Marinduque and Romblon provinces were both declared rabies-free in 2012 and 2019, respectively. It proves elimination is possible with this kind of coordinated, sustained effort.
That's fantastic news. Elimination is possible.
It is, but there's a coda. Romblon had another outbreak in 2020.
Oh, really? After being declared free?
Yes. It's a stark reminder that you can't let your guard down. Vigilance and continued programs are absolutely essential, even after achieving elimination status.
A sobering but important lesson.
Wow.
This has been quite the deep dive. The rabies situation in the Philippines is clearly dangerous. It's ongoing.
It is.
But stories like Sarah's survival show there's hope when the right actions are taken quickly.
Absolutely. Swift action, proper wound care, accessible PEP, they save lives.
And the tragedies, like Jamaica's death or those PEP failures, really underscore the need for immediate response and complete, correct treatment. No shortcuts.
None. Every step matters.
So boiling it down, achieving that 0 by 30 goal seems to rest on a few key pillars.
I'd say three main things: mass dog vaccination, getting those coverage rates up consistently; public education, tackling myths, promoting responsibility; and accessible PIEP, making sure everyone who needs it can get it quickly and affordably.
It sounds like a massive undertaking, but achievable with focus.
And with everyone playing a part.
Right. So for you listening, what's the takeaway? What's the call to action, even if you're not in the Philippines? Vaccinating our own pets seems like a baseline.
Definitely. Universal responsibility for pet owners everywhere. Get your pets vaccinated against rabies.
What else can people do?
Well, report strays or unvaccinated animals to local authorities. Help prevent potential exposures in your own community.
Okay.
Talk about it. Spread awareness, friends, family, about the risks, the importance of immediate medical help after any animal bite.
Don't just ignore a scratch or a nip.
Never ignore it. Support local efforts if you can. Animal shelters, ABTCs, vaccination drives, even small contributions help.
And advocating for change.
Yes. Advocate for stronger enforcement of animal control laws, more funding for rabies prevention, for research into better vaccines and treatments.
Yeah.
It matters globally.
Those are all really concrete actions. And it leaves us with a broader thought, doesn't it? This intricate link between human health and animal health.
Yeah.
It makes you think, what role can each of us play in our own communities, maybe beyond just rabies, in preventing these zoonotic diseases, in safeguarding public health overall?
That interconnectedness, it's something worth reflecting on long after this conversation ends. What's our part in that bigger picture?